at one of the most successful mass vaccination clinics in the nation. The ACT vaccination program has continued to set new records, and today we're very pleased. We've gone over 98% first dose coverage across our 12 plus eligible population. This is a very significant achievement for the Territory, and one that we could not have done without the incredible hard work of the team at Canberra Health Services, supported by ACT Health. Thousands and thousands and thousands of people have had the opportunity to get vaccinated at this clinic, at the Canberrans Surge Centre earlier in the pandemic, and at the airport mass vaccination clinic, together with the AstraZeneca clinic at Calvary Hospital. It's been an exceptionally strong program that's seen ACT government clinics deliver nearly half of all of the doses in our program that is nation leading. And so from today, we're very pleased to be able to announce that the clinic is now available for walk-up appointments. You don't need a booking. And so for the remaining several thousand Canberrans who are yet to get a first dose, they can walk up and get vaccinated here at the AIS mass vaccination clinic. The operating hours are 8 in the morning to 8:30 p.m, 7 days a week, and over the next 4 days in particular, as we get to the point that the lockdown ends, we are very strongly encouraging the remaining Canberrans who are yet to get vaccinated to come forward. We have a pop-up clinic out at West Belconnen at the Kippax Library operating over the next 4 days as well, and we continue targeted outreach programs as well as these mass vaccination hubs. Based on the forward bookings within our system, we think we will cross over from 98% to 99% first dose. What we've seen in the balance of the program in the last few days, yesterday for example, only 15% of all the vaccinations were first dose, 85% were second dose. So our second dose level, our fully vaccinated level, is a full 25 percentage points behind the first dose, but that's going to change very rapidly over the next 3 weeks. And where we hope to be by the end of October is well over 90% of the ACT eligible population, that is 12 years and above, who will have had 2 doses of the vaccine. We also have access now for immunocompromised people to a 3rd dose of Pfizer. It can be undertaken with your GP, and I understand GPs are already contacting people in those circumstances to book them in for a 3rd dose. We will of course work with the Commonwealth Government on the booster program for the general population, but that comes after we have completed the primary program. And that is the focus over the next 3 weeks. The next 4 days in particular, about those remaining first doses, and then with the dosing interval of 3 weeks for Pfizer and 4 weeks for Moderna. We look forward to seeing the fully vaccinated figures match the first dose figures, and that should be achieved for people who are having their first dose this week in early November. What this means is that Canberra will be amongst the most vaccinated places in the world. And this is just so critical to our economic recovery, to protect our health system, and to ensure that Canberrans can emerge from lockdown and the gentle steps that we take over the coming 2 to 4 weeks back into a more normal life. That's something I'm sure we are all looking forward to, and the first stage of that will begin on Friday. I'll now invite Catherine Wakefield, who is the Director of Nursing at Canberra Health Services to talk a bit about the program that has been put in place here at the AIS clinic, together with the other clinics that have just been so exceptional in delivering vaccination to Canberrans. The only thing that's been holding us back has been vaccine supply, and we've seen now we've got the supply, just what a strong level of take-up the Canberra community has shown in wanting to get vaccinated. Catherine?
Thank you, Chief Minister, and good morning, everyone. Welcome to the COVID-19 vaccination clinic here at the AIS Arena. My name's Catherine Wakefield and I'm the Director of Nursing for the Canberra Health Services COVID-19 testing and vaccination clinics. If you ask any of the staff working in our services, they'll tell you it's been such a privilege working for us in this COVID-19 response, and it's been such a rewarding and both logistically challenging time. When we first recruited our COVID-19 testing staff back in March 2020, we didn't quite realise then that they would later form the backbone of the COVID vaccination program. And we certainly had no idea we'd be delivering thousands of vaccinations here at the AIS Arena. And most recently to 12 to 15-year-olds. And I really like seeing them take their selfie after their vaccination to share with their friends and family. Yet here we are, 8 months after administering those first doses, and we've nearly vaccinated our entire population, aged 12 years and older. And I acknowledge the work of primary healthcare and pharmacies in that effort as well. I reflect back to February when we received the very first tray of the Pfizer COVID-19 vaccination, and I can tell you that we treated that tray with the utmost of care. And nothing's changed today when we receive many more trays of the vaccine, and we take very special care of every single dose that we get. I'm so proud of the team. Every time I hear an update on the number of Canberrans that have received their first dose or are fully vaccinated, I know that our efforts have been worthwhile. Seeing the lovely comments acknowledging our work on social media and hearing the positive feedback from consumers after they leave the clinic having received a dose has helped us all to stay focused on the job. One of the joys of this work has been the diverse group of colleagues that we work with. The team consists of such a depth of experience and expertise. We have nurses where this is their very first nursing job, right through to the retired nurses that have responded to the call to action, come back to work and brought their expertise and experience with them. We have pharmacists on our team, and most recently the undergraduate student nurses and midwives that have joined us, which have such a joy and enthusiasm that they bring to the job. We have team members with specialist skills that they've brought with them, from trauma to midwifery and even oncology, and they've moved across to help with this mammoth effort. And a special mention to the administration and operational support staff. They are so important to making everything run so smoothly like it does. I know that in the weeks and months ahead, we will continue to vaccinate people. We've got more first and second doses to give, further in-reach clinics to plan, and now third doses for those that are eligible. Many of us will keep busy with COVID-19 testing, but others will move into the areas of the health system in preparation for the next phase of the COVID-19 response. I'm so pleased to see some of our team members already taking the steps to develop their skills, training and knowledge, and undertaking placements in the health system and hospital in ready for that next phase of the pandemic. Knowing that these team members will be caring for our community in the next phase of the pandemic gives me great confidence in the future of our health system. But we're not done yet. We're still here and we're ready to welcome you to the AIS Arena at a time that suits you. There's no booking required, and if you already have an appointment or want to make an appointment, you can still, and there's no change for you. If you're not yet vaccinated, please come and see us. We'd be so happy to see you. Just walk on in. It takes less than 20 minutes for most, and the vaccination will protect you, your friends and family, and our community. Thank you.
Thank you very much, Catherine. We're happy to take questions.
Chief Minister, does the ACT reaching 70%, does that trigger any of the changes to Commonwealth support payments for Canberrans?
Well, it shouldn't do until they've formally made that declaration through Services Australia. At that point, it does then require those who are receiving the COVID disaster payment to reapply rather than it being an automatic payment, and that transition continues until the territory reaches 80%. Then the week after that it starts tapering down. So we can anticipate that payments will continue through October and into early November, but potentially at a slightly reduced level depending on the circumstances of the individual.
With vaccination going so well, does that give the ACT any capacity to accelerate the easing of restrictions, so you're going to stick steadfastly to the pathway?
Well, the pathway is very comprehensive, but there are areas of very fine detail that clearly are announced ahead of each step forward being taken. So we will announce tomorrow the detail of the next step, which will commence on Friday. We also hope by probably Wednesday or Thursday to have confirmation from New South Wales as to how they will regard the ACT in terms of their own COVID travel arrangements once we come out of lockdown on Friday. So I know that's a very commonly asked question of when can we do various things. We would hope to have answers on those questions in coordination with New South Wales ahead of Friday.
Keen observers would note that you didn't announce the case numbers today. They were released prior. Does this mark a shift in how those numbers will now be communicated?
Yes, that's correct, yes.
And so they will be announced?
So they'll be announced earlier and made available in the format that we started yesterday, in fact, yes.
Chief Minister, fully vaccinated residents in New South Wales have a range of more freedoms, as it was, from today. Is there going to be some temptation for people from Canberra to nip over the border to go shopping, or even pop into the pub after work if they're working in New South Wales? And what's your advice to Canberrans and people around the border region in the coming weeks and days where we've got this real difference between restrictions?
Sure, it's a handful of days. I understand New South Wales will be aggressively enforcing their rules. So ACT residents would face hefty fines if they went across the border into New South Wales, if you're unvaccinated in particular. But clearly New South Wales still have a travel halt on ACT residents, and the Cross-Border Commissioner has been very clear that today is not an opportunity for Canberrans to go into New South Wales for non-essential reasons. Now, travel will change on Friday, and then it will change again further at the end of October, and then in December, when New South Wales drop their vaccinated versus unvaccinated status, travel will free up significantly.
And on vaccination targets, that laggard group, the 20 to 24-year-olds, is that who you're hoping that might be targeted by enable people just to walk up to clinics rather than having to book?
That's one factor. We're also conscious that we believe thousands of people who are in that age cohort who are university students are just actually not in Canberra. So whilst I think the overall ABS population estimates are within several thousand of our actual population, it's clear that there are more people over 50 than the ABS thought in Canberra at the moment, and there would appear to be fewer people aged between 20 and 24 in Canberra at the moment. That makes sense based on what we know about international students not being here and a number of domestic students being back in their home state or territory, and their Medicare addresses would be back in their home state or territory. So we think the two will roughly balance out, give or take a couple of thousand people, which is why we're confident that 98 to 99% vaccination coverage is where we'll end up.
Does that Kipax walk-in clinic sort of factor into that thinking as well?
That's more around some vulnerable sections of the community who may not be able to travel even into where we are today. So part of our outreach, which began weeks ago but is continuing, will be to look at particular postcodes and geographic areas of the city where the vaccination rate is a little bit lower and take vaccination services out to the people there.
On outdoor dining and arrangements for businesses to maybe use public space, a number of businesses we've spoken to say it's impractical. It doesn't really give them that much more freedom. They'd much rather just be able to serve takeaway perhaps to customers in that sense. What's the thinking behind this?
Well, there's literally hundreds of businesses that can take advantage of it. So I recognise not every restaurant, cafe or eatery, coffee shop will be able to use this, but hundreds will. And so we're doing what we can in that context. And as the next few weeks go by, we get the second dose into the under 40s, then things free up significantly in about 17, 18 days. And then beyond that, things will start to look a lot more normal as we come into summer.
Who is pushing for this? Have businesses come forward asking for this?
Yes, we've had engagement across a number of areas of the hospitality industry. We've also taken it upon ourselves to be proactive in this context. It's not a new thing. We've had free outdoor dining permits for hospitality businesses for some time now. We've had a general policy push to support al fresco dining, and we're just taking it a step further. What it will mean is that some car parking spaces, some side streets that would otherwise be reserved for cars will in fact be freed up for people. Now, it's not main streets, it's side streets in the odd parking spot that will enable outdoor dining for up to 50 people, which will expand the capacity of operation for many businesses. It's not an unfamiliar model. It's been successfully deployed in other cities around Australia and around the world.
How will you determine how much space each restaurant is allocated outside?
Well, there'll be a site-by-site assessment undertaken by the rapid response team. Many businesses already have identified outdoor areas that would comfortably cater for 50, but where it's a case that they might need a little bit of extra space, the team will work with them to try and make it possible.
Is it the situation now that case numbers don't really matter? That the vaccination rate is the key metric, and that even if cases surge over 50, 60, that's not going to stop us from going out of lockdown.
Sure, yes. So the vaccination rate is the most important protection now, but we still have our other two areas of protection being the public health social measures and test, trace, isolate and quarantine. Now, we'll be updating the settings for TTIQ this week as well, so there'll be absolute clarity on who needs to quarantine and when. Bottom line, if you are carrying the virus and you are a case, then you are still going to have to quarantine, but there will certainly be changes around casual contact settings and the like. We'll outline those in the coming days. But the vaccination program does the heavy lifting. That was how it was always intended to be in making this transition. We are particularly focused, obviously, on keeping case numbers as low as possible. But the disease is going to become endemic in our community. There will be hundreds and hundreds of cases, but the vaccines will prevent serious illness. And you just need to see what's happening in New South Wales and Victoria to know that there aren't many people in intensive care who are fully vaccinated. There aren't many people even in hospital who are fully vaccinated. But you can still, of course, have a breakthrough infection. So fully vaccinated people can still get the virus, can carry it with them for days and days and transmit it to others, and they may not even know they've got the virus. So there'll still be a need for public health social measures and test, trace, isolate and quarantine arrangements. But whereas if they were our main defence when we didn't have vaccines, we now have vaccines and we now have nearly 99% first dose coverage. So I know people will be very excited about 99%, and it is an amazing result for this city. But that's first dose. Fully vaccinated is still sitting in the 70s. And so the next 3 weeks are about getting all of those people who've had a first dose, getting them a second dose. And so that's why we're not having Freedom Day today. That's why it will be a gentle step forward on Friday, and then another one 2 weeks after that. A cautious and managed approach that protects the health of everyone in the community. Because the people who haven't had their second doses are all of those under 40 principally, with several hundred people over 40 who are still waiting for second doses, particularly of AstraZeneca. But mostly this is about the most active people, the ones who effectively are the bridge between generations, the ones who have young unvaccinated kids. So we need to get these people fully vaccinated, and that's what the next 3 weeks is about.
Just on the border stuff again, on Friday, some people in border towns who are unvaccinated might seek to come over to the ACT and take advantage of the freedoms that they're not afforded in those towns. Will the ACT be policing that at all, or will that be just a matter of...
Well, the reasons for travel are not going to change dramatically on Friday. The number of postcodes within the Canberra region standing exemption will increase. And that will be the arrangements really for the last 2 weeks of October. Beyond the point at which New South Wales reaches 80% double dose, they've then indicated that they will make changes, for example, to allow Greater Sydney to travel into the regions. That would then presumably be a trigger point at which the ACT would also be allowed to travel further into the regions.
If the New South Wales changes their law, like rules to allow travel between the ACT, but you've still got the standing exemption, will it be the case that people from Queanbeyan won't be able to go and have a drink in the pub on Friday night?
Well, there wouldn't be an essential reason for travel to come into Canberra on Friday, no.
Okay. And obviously with reopening, where you can assume that there's going to be lots more close contact and casual contact exposure sites, what work's been done to ramp up testing centres, and will sites such as Brindabella, which closed, be able to be readily resume again?
Yeah, so we'd anticipate there being some further demand on testing, but we have the capacity to flex that up either at our existing centres or to do pop-up testing in certain contexts. But TTIQ is going to be phased down from what we've been used to over the last 18 months. It's not going to be the same process, but we'll have some further details on that in a couple of days.
You've often talked about 2-week lag before vaccination is effective. So with those 80 and 90% double dose marks you're talking about, when do you expect them to be fully effective?
Well, we will obviously start seeing the benefits of the 2-week lag for the people who've had their second dose this week in 2 weeks' time. But we are tracking over 70% now of 12 plus. We've just sort of checked over that point, and so by the end of October, we certainly will have had everyone who is at the 70% mark will have had 2 weeks. And then the 80% mark will also be pretty close to 2 weeks by the end of October. No one really modelled getting to 90, 95 and then 99%. If I could make one observation, and this is probably based on expectations of what happened elsewhere in the world, that there wasn't that much ambition for Australia's vaccination program beyond 80%. So I have always viewed 80% as a floor, not a ceiling. And I think Canberra has demonstrated that it should always have been a floor, not a ceiling, and that the community would come out in even greater numbers to get vaccinated. That's been this country's story with vaccination, even before COVID. So it really, frankly, and we've had this argument, about getting access to vaccines for the ACT over the last 3 or 4 weeks, that no one believed we'd get here in the federal government. There was just this sense that it wouldn't be possible, that it couldn't be done. But even New South Wales has got over 90% now, and Victoria's well on their way too. So I think we should be ambitious about the national vaccination program. But none of the modelling was done based on 90 or 95 or 99% coverage. But you'd much rather be in that position than hovering at around 70. All good?
Thank you.
Terrific. Thank you.
Yeah, perhaps if I was standing in front of the flowers or something, that might look nice.